It's been doing that with our weather as well.
Really?
Yeah, suddenly.
Come on, come on. It just goes into a beach ball. Okay, there you go. You're not gonna talk, na? स्पाइस रेडियो और रेडियो रिमझिम सुन रहे हैं आप। गपशप का प्रोग्राम है। हमारी घड़ियों में बाद दोपहर के 2:06 हुए हैं। अब से लेकर 3 बजे तक आपका और हमारा साथ रहेगा हमारे आज के इस कार्यक्रम में, जिसका नाम बड़े प्यार से हमने गपशप रखा है, क्योंकि इसमें वो सभी बातें जो आज आपकी नज़रों में अटकेंगी, खटकेंगी और दिल में समाएंगी, उन सबको लेकर हम हाजिर हैं, ये बताते हुए कि हमारे स्टूडियो के बाहर का तापमान, बिलीव इट और नॉट, 28 डिग्री सेल्सियस है। एंड जस्ट थोड़े से बादल हैं आसमान में, वो भी नहीं है, वो भी धुल चुके हैं कम्प्लीटली। और इतनी धूप आज रहेगी कि आज के बाद तापमान थोड़ा कम होना शुरू होगा। लेकिन स्टूडियो के अंदर चूँकि एसी चल रहा है, इट्स नाइस कूल वेदर एंड वी हैव गॉट एन अमेजिंग वुमन इन द स्टूडियो। आपको बहुत दिनों से हम बता रहे थे कि रामिया विनोद आज हमारे प्रोग्राम में आएंगी एंड शी इज़ हियर एंड वी आर गोइंग टू बी टॉकिंग अबाउट वुमेन्स हेल्थ, especially pelvic health, right?
Yes.
Welcome to the program.
Thank you, Shushma ji. Happy to be here.
So we've been talking about women's health, but what is it particular about the pelvic health that you're most concerned about?
So pelvic health is basically it is for all age women. People often think it is for one particular age group, but it is in general for everyone, no matter what their age is. So pelvis is the area where like below the waist, where all the pelvic floor muscles are there. Pelvic floor muscle has a very huge function, जो very very less understanding it's there for all the humans.
Yeah. तो क्या लोग इसको अच्छी तरह से नहीं समझते कि ये डॉक्टर भी नहीं समझते?
I can't blame doctors. Definitely doctors बहुत समझते हैं, but the problem is आज मैं ये चीज़ बताने आई हूँ कि no matter even if doctor insist, patients उसको lightly ले रहे हैं. They are not thinking it is important. Even if the doctor refers them कि pelvic physio के पास जाओ, they don't come.
Okay, so let me just take you back. Pelvic physio किस केसेस में होती है?
Yes. So generally physiotherapy तो सबने सुना होगा, right? So जहाँ ICBC के एक्सीडेंट्स में फिजियो देते हैं और WCB में कुछ वर्क सेफ में हो जाता है तो फिजियो को भेजते हैं. एंड इवन इफ जनरली किसी को भी नेक पेन होता है, नी पेन होता है, बैक पेन होता है, पीपल जनरली गो टू फिजियो, राइट? तो दैट इज रेगुलर फिजियो जो हर कोई करता है. पेल्विक फिजियो एक स्पेशलाइजेशन होता है. यस. सो जस्ट लाइक देयर आर मेनी स्पेशलाइजेशन इन फिजियोथेरेपी जो even people don't know that. कार्डियो में भी है, कार्डियोलॉजी, हार्ट और लंग्स रिलेटेड फिजियो भी है. आईसीयू में है जो पीपल कैन ट्रीट इन आईसीयू, जो एडमिटेड है आईसीयू में. एंड स्पोर्ट्स रिलेटेड फिजियो है, ओनली फॉर एथलेट्स हु गेट इंजर्ड. हैंड फिजियो है, देयर इज ओनली somebody special in hand. So there are different categories, specialties, out of which pelvic mainly focuses on your core muscle, ताकि हम our abdomen muscle, and also the pelvic floor muscle which is in between both the legs. It is there for both men and women.
अच्छा, तो दोनों के लिए है?
Yes. So usually what happens, it is mainly getting affected during pregnancy or delivery के बाद.
अच्छा, औरतों में?
Exactly. So उस impact के बाद, pregnancy के impact के बाद, often women don't strengthen the muscle. वहाँ से शुरू होता है.
And what are the fallout from that? कि अगर वो केयर नहीं करते तो उनको क्या नुकसान होता है?
Yes. Number one, पहली प्रेगनेंसी में उनको ज़्यादा फील नहीं होता है, बट फिर भी आफ्टर डिलीवरी दे ऑलवेज कंप्लेन कि मेरी बैक पेन हो गया, एंड दे से लाइक इट डजंट गो अवे. मैंने बहुत मसाजेस लिए, मैंने बहुत आई हैव सीन सेवरल फिजियो एंड कैरोप्रैक्टर, मेरी बैक पेन नहीं जाता है. सो दैट कुड प्रोबेबली जस्ट बी फ्रॉम द वीक कोर मसल्स एंड योर वीक पेल्विक फ्लोर मसल. बट सबसे ऊपर प्रॉब्लम क्या होता है व्हेन दे गो टू द सेकेंड प्रेगनेंसी एंड डिलीवरी, द प्रॉब्लम डबल्स एंड स्पीड्स अप, बिकॉज उन्होंने अपनी बॉडी को तैयार नहीं किया सेकेंड प्रेगनेंसी के लिए.
तो जो बैक पेन है वो ज़्यादा हो जाती है और उनके लिए उसको ख़त्म करना या उससे निजात पाना मुश्किल हो जाता है?
यस, सो यूजुअली हमने बहुत सालों से ये सुना होगा कि जो भी लेडी डिलीवरी के बाद बोलती है कि मुझे बैक पेन एपिड्यूरल की वजह से हुआ है, यू मस्ट हैव हर्ड इन सेवरल टाइम्स, राइट? हाँ, बोलते हैं कि मैंने एपिड्यूरल लिया, मैंने गलती कर दिया, उसकी वजह से मेरी बैक पेन हटती नहीं है। तो अभी रिसर्चर्स ने प्रूव किया है, इवन एनेस्थेटिस्ट इफ दे आर लिसनिंग दे वुड अग्री विथ मी दैट एपिड्यूरल डजंट कॉज लो बैक पेन लॉन्ग टर्म, क्रॉनिक लो बैक पेन नहीं कॉज करती है। एंड इट इज बिकॉज वो डिलीवरी के बाद अपना मसल्स स्ट्रेंथन नहीं करती है, उसके वजह से उसको बैक पेन हो रहा है।
सो क्या क्योंकि ह्यूमन बॉडी इज सच एन अमेजिंग चीज़ बनाई है भगवान ने कि वो अगर हम खराब भी उसको कर लेते हैं तो हम में अपने में शक्ति है उसको ठीक करने की, लेकिन हम करते नहीं हैं वो। तो इज इट अ सिंपल एक्सरसाइज और सिंपल चीज़ करने की ताकि वो ठीक हो जाए, कि उसमें बहुत एक्सटेंसिव काम करना पड़ता है बैक मसल के लिए?
इट्स अ वेरी गुड क्वेश्चन, बिकॉज हर विमेन को यही लगता है कि अगर मैं इसके पास जाऊंगी तो उसको लंबा लिस्ट देने वाली है कि ये एक्सरसाइज करो, वो एक्सरसाइज करो। इट इज डेफिनेटली नॉट दैट, इट इज जस्ट बेसिकली अंडरस्टैंडिंग कि हमारी मसल्स को कैसे अब्यूज ना करें। लाइक हमारी पॉस्चर को, फॉर एग्जाम्पल अगर डिलीवरी के बाद वो बेबी को झुक के उसका डायपर चेंज करती है या बेबी को उठाती है, आई विल जस्ट टीच उस टाइम पे उस मसल को क्या करना चाहिए ताकि वो बैक पे असर ना जाएगा। So just with the simple body mechanics and posture, she can prevent a long-term back pain का, she can stop it. And then छोटे मोटे एक्सरसाइज से we can start strengthening and building the strength.
भारत में और ख़ासतौर पे गाँव में, राइट, जब बच्चा पैदा होता था तो दाइयाँ आती थी, राइट? बच्चा पैदा होने के बाद वो अच्छी तरह से मालिश करती थी, पेट की मालिश करती थी, बॉडी को संभाल के रखती थी माँ। फिर वो क्या पंजीरी वगैरह बनाती थी ताकि वो खिलाएं। एंड औरतें एटलीस्ट विद इन अबाउट 7 to 10 days अपना अच्छा उनका स्ट्रेंथ बन जाती थी कि अपने बच्चे को देख सकती हैं, राइट? विच आई डोंट थिंक हैपन्स हियर इन दिस कंट्री। एम आई राइट?
एग्जैक्टली, सो वेरी वेरी ब्यूटिफुली सेड। ऑफ कोर्स हमारी जो ट्रेडिशनल थिंग्स है ना, वो हम काफी मिस कर रहे हैं यहाँ, राइट? तो इवन मिडवाइफ एंड ऑल दोस द सपोर्ट वी यूज टू गेट देयर ड्यूरिंग डिलीवरी, पोस्ट डिलीवरी, द मसाजेस जो आप बोलते हो कि ये जो मसल है ना, जो प्रेगनेंसी के टाइम पे बहुत स्ट्रेच हो जाता है, उसके बाद उसको मॉलिश करना और उसको काम पे लगाना विल एक्चुअली मेक इट रिट्रैक्टेड एंड इट इज गोइंग टू मेक इट स्ट्रॉन्गर। एंड हमारे इफ यू सी इंडिया में तो हेल्प मिलता है। सो इफ अ वुमेन हैव अ नॉर्मल डिलीवरी और सी सेक्शन, डेफिनेटली उसको बेबी को देखभाल करने में, ट्रांसफर्स में, बच्चे को संभालने में हेल्प मिलता है। सो व्हेन दे गेट हेल्प द हीलिंग इज बेटर। एंड जैसे आपने बोला वो पंजरी खाना, वो सब में एक मेडिसिनल वैल्यू होती है।
बिल्कुल। और ख़ासतौर पे पंजाब में अगर पंजीरी खिलाई जाती है तो महाराष्ट्र में कुछ और खिलाया जाता होगा, गुजरात में कुछ और खिलाते होंगे। एंड इट्स प्रोबेबली फुल ऑफ मेवा और खोया और ये और वो, जो कि घी वगैरह डाल के सब कुछ, ताकि उस टाइम पे शायद औरत के जिस्म को उसकी ज़रूरत होती है।
उस टाइम पे नहीं सुषमा जी, हर टाइम पे होती है। लाइक अगेन पीपल थिंक घी इज समथिंग व्हिच इज अनहेल्थी। आई वुड से डेफिनेटली घर में बनाया हुआ अच्छे बटर से, इफ यू डू लाइक होम मेड घी, दैट इज द बेस्ट हीलर, right? Like it heals the injury.
Right.
So pregnancy is basically like हमारी बॉडी में इतने चेंजेस होते हैं, डिलीवरी के बाद our body has to retrieve. एंड जो सी सेक्शन में हो रहा है आजकल, इट इज लाइक द इंटरनल इंजरी हैपनिंग, राइट? सो उसमें 8 लेयर काटते हैं हमारे पेट में।
8 लेयर्स?
या ऊपर से एक स्टिचेस हमें दिखता है, बट अंदर से और 7 लेयर्स होता है। सो वो उसको हील होने में टाइम लगता है और पीपल जस्ट दे आर रश टू गेट बेटर।
बट एक बात मैंने और भी नोटिस की है, आई डोंट नो वेदर आई एम गोइंग ऑफ द टॉपिक और नॉट, कि ऑपरेशन के बाद, किसी भी तरह का ऑपरेशन हो, उसके बाद बहुत जल्द अस्पताल से घर भेज दिया जाता है। आई हैव इवन सीन अप टू, आई मीन फॉर माय ओन नी ऑपरेशन, आई एम केप्ट देयर ओनली फॉर 2 nights. 3rd night आई एम एट होम। और एक ज़माना होता था कि 2-2 हफ्ते आपको अस्पताल में रहना पड़ता था। सो उसके पीछे कारण क्या है?
There are two things I would say, like pluses and minus in that. उसमें माइनस ये होगा कि वो फॉलो अप कम हो जाएगा, राइट? क्योंकि घर जाने के बाद क्या होता है, इसलिए इफ यू सी लाइक सी सेक्शन के लिए 5 दिन रखते हैं, वैसे नॉर्मल डिलीवरी के लिए मैक्सिमम 2 दिन रखते हैं. बट आई थिंक दैट इज बिकॉज ऑफ यू नो द सिस्टम हियर, राइट? कि यहाँ जगह नहीं होता है हॉस्पिटल में. बट इन अ वे आई वुड से इट इज ऑल्सो गुड, बिकॉज जितने लंबे आप हॉस्पिटल में रहते हो उतना ज्यादा हॉस्पिटल एक्वायर्ड इन्फेक्शन आता है. यू आर गोइंग टू गेट मोर सिक इफ यू आर स्टेइंग इन हॉस्पिटल फॉर नो रीजन. अगर आप हेल्थी हो, आपके वाइटल स्टेबल्स है, आपको और कोई प्रॉब्लम्स नहीं है, देन दे शुड गिव यू सम लिस्ट ऑफ सिम्टम्स एंड टेल यू कि अगर ये हुआ देन कम बैक, अदरवाइज यू आर डूइंग गुड. देन द पेशेंट हैज अ क्लियर इन्फॉर्मेशन कि दिस इज नॉर्मल, दिस इज नॉट नॉर्मल, एंड दे कैन टेक केयर ऑफ देमसेल्फ एट होम if the provided the surgery is very minor.
आपने बात की कि पहले बच्चे के बाद तो ठीक होता है, ज़्यादा लोग महसूस नहीं करते, दूसरे बच्चे के बाद शायद वो महसूस करना शुरू कर लेते हैं. व्हाट अबाउट जिन लोगों के यहाँ 6-6, 7-7 बच्चे होते हैं?
Yeah, like I have seen most of my patients जिनका 2 बच्चे से ज़्यादा है, like 3 बच्चे 4 बच्चे हैं, जितनी ज़्यादा डिलीवरी होती है बॉडी उतना ज़्यादा डैमेज हो जाता है. एंड इट इज़ नॉट लाइक पिछले एक ज़माने में तो 10-10 बच्चे पैदा करके, और नो ग्रैंड मदर्स वेर वेरी स्ट्रॉन्ग. आई नो लाइक माई ग्रैंड मदर वॉज द स्ट्रॉन्गेस्ट वुमन आई एवर मेट इन माई लाइफ. शी हैड 10 kids, right? So आज क्या हो रहा है, like what is happening now is all because we are totally not healthy. Our lifestyle is not healthy, our khana pina is not healthy, everything is adulterated, right? So we lost the inner strength.
वो ही नहीं है हमारे पास.
Yeah.
हम बात कर रहे हैं रामिया विनोद के साथ, जो कि पेशे से एक फिजियोथेरेपिस्ट हैं. और आज के इस कार्यक्रम में हम चाहेंगे कि अगर आपके पास कुछ सवाल हो तो आप बड़े शौक से हमें फ़ोन कर सकते हैं. हमारे टेलीफोन लाइन्स हम अभी से खोल रहे हैं, 604-280-1200 या 604-299-8863. और रामिया से आप अंग्रेज़ी में या हिंदी में सवाल कर सकते हैं. अगर आप पंजाबी में भी बात करना चाहते हो तो मैं उनको ट्रांसलेट करके बता सकती हूँ. आइए छोटी सी कमर्शियल ब्रेक लेते हैं और उसके बाद रामिया के साथ ये बातचीत जारी रखते हैं. रेडियो रिमझिम सुन रहे हैं, आप गपशप का प्रोग्राम है. रामिया विनोद आज हमारे साथ हैं. पेशे से वो फिजियोथेरेपिस्ट हैं और आज हम पेल्विक हेल्थ, सेक्सुअल हेल्थ, इन दोनों की भी बात करेंगे. लेकिन पेल्विक हेल्थ इज़ मोर इम्पॉर्टेंट आई थिंक हमारे सुनने वालों के लिए, क्योंकि जो औरतें इस वक्त यंग हैं, शादी हुई है, उनकी बच्चे ऑब्वियसली वो चाहते हैं कि पैदा करें, दुनिया को और आगे बढ़ाएं, एक्सेट्रा एक्सेट्रा एक्सेट्रा. तो उन लोगों के लिए ये इंटरव्यू ज़रूरी होगा, या उन औरतों के लिए जिनको हमेशा से बैक पेन रहती है. तो उसमें एक चीज़ जो है जिसको मद्देनज़र रखना है वो ये कि आपकी जो बैक पेन है वो कब शुरू हुई और कैसे शुरू, क्योंकि व्हेन यू आर पिकिंग अप हैवी स्टफ देयर इज़ अ वे टू पिक अप स्टफ. आप बिल्कुल मुड़ के कुछ सामान नहीं उठा सकते. यू हैव टू गिव वेट ऑन योर थाइज to pick up something, right? तो ये चीज़ें आप सिखाते हैं जब लोग आपके पास आते हैं?
डेफिनेटली. सो जो भी आते हैं मेरे पास विद बैक पेन, वी आर नॉट जस्ट गोइंग टू उनको उल्टा लेटा के बैक की मालिश करके कुछ मशीन लगा के हीट लगा के बस बेचना हमारा काम नहीं है. दैट्स नॉट द वे वी वर्क. व्हेन आई से वी, इट्स माय हस्बैंड एज वेल, वी बोथ आर फिजियोस, सो वी बोथ आर फ्रॉम सेम स्कूल, सेम कॉलेज. सो हमें हमारा स्टाइल अलग है. सो वी गो through in and out of their life, like we ask them every single question regarding their job, regarding their उनका मैट्रेस कैसा है, कौन से पोजीशन में सोते हैं, अगर वो जॉब प्रोलॉन्ग सिटिंग होता है, नहीं तो ट्रक ड्राइवर्स है, और इफ दे आर वर्किंग इन वेयर हाउस लिफ्टिंग वेट्स. आई मीन नाउ आई गेट सो मेनी पीपल फ्रॉम Amazon बिकॉज दे लिफ्ट वेट एंड उसके बाद बैक पेन हो जाता है. सो दीज पीपल वी गो इन एंड आउट ऑफ व्हाट्स हैपनिंग थ्रू देयर one full day, and then we figure out what are the mistakes they are doing. If the mattress is so soft, then we will tell them you have to change it. If the sleeping position is weird, some people have a terrible habit of sleeping on their tummy.
I do.
Okay, you need to see me, Shushma ji. You know my clinic address. So sleeping on back on tummy has a very bad effects, both for your neck and your low back.
अरे छोड़ो यार, हमारे कुछ भी नहीं हुआ अभी तक. I'm in my 70s.
Yeah, because you're from the good generation. you had good healthy genes.
Actually, You know, I'm glad that you mentioned that because मैं ये महसूस करती हूँ that in the olden days and in families where food for the children is the priority. बच्चा पैदा होता है, उसके खाने कब से कब उसका खाना होना चाहिए, कितने बजे उसको सोना चाहिए, क्या 24 घंटे वो टेलीविजन ही देखता रहे. I mean, आजकल के बच्चे अगर आप देखें, माँ बाप के पास इतना काम होता है कि the only thing that they give to children is a little iPad या अपना iPhone दे देते हैं कि ले तू उसको देख के अपने आप को अम्यूज करता रहे. That is not the way to bring up your children. But I am not here to say nasty things about the parents. I'm just gonna say you said good genes हैं.
Yes.
Our mother made sure that we ate healthy food.
So
जंक फूड तो महीने में एक बार ज़रूर मिलता था. And that was when dad would take us all to eat a lot of jalebis and machanga etc. लेकिन हर हफ्ते हमारे घर में कोई तला हुआ खाना नहीं पकता था.
so
Fresh food
Yeah.
every day for breakfast, lunch, snack and dinner. Having said that, हम एक ऐसी दुनिया में रहते हैं जहाँ पे दोनों मियाँ बीवी को काम करना पड़ता है. बच्चों का बेबी सिटर जो है वो हमारा आईफोन है. और आई वाज टॉकिंग टू ऑप्टोमेट्रिस्ट डॉक्टर मिनी रंधावा. वो इतने वरीड है कि आगे चल के जितने भी बच्चे बड़े होंगे उनको ज़्यादातर प्रॉब्लम आइज़ की
ice
होगी.
cube, yes.
So there's so many different parts in our body that we have to look after.
Yes, it is not only the eyes. I feel it is also behavioral problem आ जाता है. For example, I have met many kids who won't look at you eye to eye when you speak to them.
Oh my God.
When you ask a question, they can't keep the eye contact. And having an eye contact is very important part of communication, which I feel like it's a major part where the person who is listening to you should feel like, okay, this person
Yeah.
is respecting me and responding to
Exactly.
me. But many kids, I find, they cannot have eye contact and they are not able to completely verbalize what they think because they are so used to listening from from the iPad or phones. Their communication skill is very, very poor.
मैं आपसे ड्यूरिंग आवर कमर्शियल ब्रेक बात कर रही थी और आप मुझसे बता रहे थे कि पेल्विक हेल्थ के बारे में ज़्यादातर लोगों को जो कि वैंकूवर, बर्नबी, रिचमंड वगैरह में रहते हैं उनको जानकारी है, लेकिन सिरी के रहने वाले लोग इसके बारे में ज़्यादा न तो बात करते हैं, न जानकारी रखते हैं, न फिजियो के पास जाके बात करते हैं. So if that is the case, ऐसा क्यों हो रहा है?
Instead of talking about ऐसा क्यों हो रहा है, I want to talk about वो क्या हो रहा है in terms of most of the doctors and the midwife and the hospitals, the other side of the world where like Burnaby, New West, Surrey, Vancouver, White Rock are well aware of pelvic physio because वहाँ बहुत पहले से pelvic physio था. The people who have been practicing pelvic physio for a long time were from those areas. Surrey में I think probably I was the first or second one who started pelvic physio, who was certified in this. And I think it's because also the nature of population. There are more Indians among Surrey, and we value about pelvic health very less because that's the least cared or spoken about. I have seen many people who are even very, very ashamed and embarrassed to still talk about their periods or still talk about what's going on down there. I have seen many patients who said, oh, I've never seen my private part in my life.
Oh my God.
Right? Like she must be like 29, 30, in 30s, but she says, what is the need for me to see? She said, I've never seen. Right, so that's the kind of society I think we grew up or we were brought up. Just to say an example, I had one of my friend who was pregnant and she lives in downtown near the Vancouver. So I said, I think you need to come and see a pelvic physio because you're pregnant, you're close to delivery, because I train people for labor. I teach them how to push the baby safely during labor so that they don't end up in tear, forceps delivery, vacuum, या C-section, या कोई complications ना हो. I teach them how to safely push the baby. So I said, why don't you make an appointment? She says, oh no, I already had an appointment booked through my midwife, suggested by my doctor. So I already had a pelvic floor physio seen. So how is a lady in Vancouver is able to, have that knowledge of pelvic physio is very important. The midwife refers and the doctor acknowledges, and here nobody speaks about it. I don't know if people are aware, but still when in my practice I'm seeing jankari bahut kam hai.
So उसके लिए I don't think we can only blame हमारी culture को ही. I think we should also hold people in that profession responsible for it as well. कि क्या आप अगर आपके पेशेंट बच्चा पैदा कर रहे हैं या करने वाले हैं, आप उनको ये सारी जानकारी देते हो या नहीं? एंड इफ़ यू डू, तो क्या उन लोगों में ये सारी हिम्मत है कि वो करें कि नहीं करें? एंड इफ दे आर नॉट डूइंग इट, देन they are to be responsible for their own bad health.
Yes. So every patient I see, they ask me only one thing. They will ask me, why did my gynecologist or my doctor, like after delivery, why didn't they tell me? Like why this? They always say कि hospital में होना चाहिए. After I delivered, you should have spoken to me the second day, third day, so that I go home with that knowledge of what is that. It is not like I suffer a lot. I know चक्कर काटो सारे डॉक्टर्स की, स्पेशलिस्ट की, दिन बाद में कोई बोलेगा और मुझे खुद गूगल पर करना पड़ता है कि how to get rid of back pain after delivery, right? So I feel कि hospitals में they should employ pelvic physio in prenatal and postnatal stage. Like there should be one pelvic physio for every postnatal ward. So this happened in India. So when I studied physio, I have gone to every prenatal postnatal ward teaching this exercise to women who are pregnant as well as women who had delivery. वहाँ जाके हम बताते हैं कि ऐसे सांस लेना है, ऐसे स्क्वीज करना है मसल को.
Although there are workshops for pregnant women, prenatal classes, जिसमें जाकर उनको बताया जाता है कि किस तरह से आपको सांस वगैरह लेना है. बट हैविंग सेड दैट, किसके पास टाइम है वो जाने के लिए? आई थिंक सम वुमेन हमारी अपनी कम्युनिटी में ये सोचती होंगी, कहाँ जाए, मैंने सुबह उठ के ये भी करना है, ये भी करना है, ये भी करना है, तो उसमें से मैं कितना टाइम निकाल के जा सकती हूँ? Could that be one of the reasons?
That is also one of the reasons. The other reason is they don't know the impact of it. For example, अगर
नुकसान क्या है?
Exact, नुकसान नहीं, उसका फायदा क्या है? They don't know that either, right? So they think कि my mother didn't have any prenatal yoga, prenatal exercise. My mother did not go for any pelvic physio. She seems fine because she is also leaking urine and she thinks it is normal.
Yeah.
And she says to the next generation also, it happened to me after baby. I was leaking urine. That is normal. It's you will leak too. That is what is happening. We are passing this information generation after generation that things are normal after delivery, and even pain, back pain during pregnancy, people normalize it. They say, oh, pregnancy में होता है.
आपने यूरिन की बात की, and that is very interesting because I think कि controlling your urine is most important. एक stage ज़रूर आती है इंसान की ज़िंदगी में when they get very old and it's very difficult. But last time when you were here, you gave all of us who were sitting here some exercises. You have to tighten your muscles.
Yes.
And you do that. And if you do that while you're sitting and tightening your muscles get used to it, don't they?
Yeah.
Isn't that a simple solution?
That's what I always tell my patients कि ये solution इतनी simple है, but आप लोग इतना life waste करते हो पैड रख के, डॉक्टर के पीछे भाग के. The only thing is, just if you understand this pelvic floor muscles function. So when you come to me, that's what I do. I just don't impose any exercise on you. मैं back in India and Malaysia I was a lecturer. So मैं अपने patients को पढ़ाती हूँ. I take my passion out in teaching the patient.
Right.
I have a whiteboard. I have all the models in my room.
Yeah.
I teach them. मैं बिठा के उसको पढ़ाती हूँ कि ये pelvic floor function कैसे करता है,
Right.
so that they understand the dysfunction, and trust me, they can stop leaking urine if they come in the correct stage to me in 3 seconds.
So जब आप कहती हैं correct stage, is there a stage after which you can't help?
Yes. So what happens is, women often think कि मुझे symptoms कुछ नहीं है. I don't have any problem right now. That means I am okay. That is the biggest problem. Why? Because most of the things can come asymptomatic. Symptoms के बिना, जैसे कैंसर में बोलते हैं ना कि मुझे कोई symptoms नहीं था, अचानक मुझे ये हुआ वो हुआ, मैंने टेस्ट किया और डॉक्टर ने बोला कि मैं स्टेज 4 में हूँ, फाइनल स्टेज में हूँ. Why? Because it is asymptomatic, right? Similarly, pelvic floor issues क्या होता है? It doesn't show up right away that you have any problem. Some women leak very occasionally when she cough or sneeze. She thinks that's normal. She ignores it. तो उसके बाद उसको थोड़ा पेन फील होता है, then again she doesn't know what to do. and slowly when it progresses and reaches a stage where the bladder या uterus बिल्कुल निकल के बाहर आ जाता है from the vagina, तब उनको फील होता है कुछ निकल के आ गया. But there was a starting stage. जब थोड़ा लीक हुआ ना, तब भी वो निकलना शुरू हो गया था, right?
So the very first time that they had that is when it was. What happens to it? What happens to the bladder? This leaves its position and starts coming down.
Exactly. क्योंकि हमारे नीचे का जो पार्ट है ना, vagina is open, और we are always standing towards the gravity. So always gravity pulls everything down. But हमारी मसल का काम ये है कि वो anti gravity काम करे कि उसको अंदर रखे समेट के, right? And also when you cough or sneeze, imagine आपके toothpaste का ढक्कन, the lid is open and you squeeze the toothpaste, the paste comes out, right?
Yes.
So the pelvic floor is like the lid of the paste. So if you are putting pressure to the your body, things pop out. If you have a good pelvic floor contraction, वो बाहर नहीं आएगा. So वो train करने में मुझे, I'm telling you not just like that. It takes only 5 seconds for me to make them understand.
Okay, so give me an example of a not giving the names, but a client that had a problem for a very long time and came to you and is happy, or one who was so difficult that to date you haven't been able to help.
Yeah, so there were I would say 75 to 80% of patients who have response in 1 week.
1 week.
1 week. They come with pain, they say next week there is no pain. They come with leak, they say I've never leaked in a week. They come with multiple other issues, in a week they say good. But the people who have had difficulty is definitely, of course, people who are more aged, like 85, 80s के आसपास कोई आते हैं, उनकी अंडरस्टैंडिंग थोड़ा कम होता है. Like when I say breathe in करो, इसको खींचो, इसको खींचो, then they are not able to connect everything. So that is one of the challenge I have. That's why I don't want anybody to come very late. The earliest is moment after you deliver. Come, if you had a normal delivery, come in 1.5 to 2 months. If you had C-section, come from 2 months to 3 months, anywhere. If you start building your strength and understanding from there, then you don't have to see me when you become old or when you nearing the menopause. At that time the problem is going to spike.
अगर आपसे कोई बात करना चाहता है, they can call us today on the program at 282-1200 or 299-8863. But if they want to meet with you and talk to you, how can they do that?
They can call me in my direct line. It's 778 320 0575.
0575. Let's take a short commercial break. Then I want to talk to you about young women who have come to program hai. और हमारे साथ आज रामिया विनोद हैं. We are talking about pelvic health. We're talking about sexual health. We're talking about just now in our break you were telling me कि जब बच्चों को माँ बाप लेके जाते हैं किसी पार्क वगैरह में या मूवी देखने के लिए या कुछ भी, they say to their kids, हम जा रहे हैं and I don't want you to be going to a public bathroom. जाओ सुसु करके आओ, go pee and then come. So you think that's bad?
That is definitely kind of bad. Like what is happening is हमारी बॉडी में एक सिस्टम होता है. लाइक फॉर एग्जांपल भूख लगता है तो हम खाना खाते हैं, नींद आता है तो हम सोते हैं, हमें वो पी करने का जो अर्ज आता है, राइट, कि माई ब्लैडर इज फुल, आई वांट टू पी. That is a natural process happening in our body. So our brain is connected to our pelvic floor, right? So what we are doing when we are forcing the kids to pee and forcing the kids to eat when they are not hungry, we are screwing up their system. Right? So जब बच्चे का bladder full नहीं होता है और you ask them to empty it, the brain is now confused. Why did the kid pee now? So the brain starts thinking that is the capacity, total capacity of the bladder, and it starts giving the urge every time when it is half full.
Oh, I never heard that before.
So what happens eventually, the bladder is not allowed to stretch as much as it can. So it remains in a stage where it cannot stretch. Then we think like, oh, I have a small bladder because जब थोड़ी सी पीपी फिल हो जाता है, I think I want to pee. You don't have a small bladder. You are not just allowing the bladder to expand by holding it. By holding, I'm not telling ki, I know many people will be like super confused, like, oh, my doctor said never hold the pee, you will have urinary tract infection, right? Of course you will have urinary tract infection if you're holding for very long time.
What is very long time?
Very long time is like, more than 5 hours, 6 hours, 7 hours, 8 hours. I get so many people like truck drivers, teachers, RCMP officers as my patients because they all hold their pee for a long time, like TransLink drivers, like, especially female have smaller bladder than male. So if they hold for pretty long time, they overstretch the bladder as well as they end up in urinary tract infection. So safely you can hold up to 2.5 to 3 hours without getting yourself infected. But it also depends upon your individual medical condition. If you have any pre-existing kidney issues or bladder issues, then this doesn't hold good for you. It is in general.
Okay, in general, अब हम पी की बात कर ही रहे हैं, तो let me just ask you this silly question. दिन में कितनी बार जाना चाहिए? अगर हम 8 गिलास पानी के पीते हैं, तो दिन में कितनी बार पेशाब करना चाहिए?
This is exactly what I teach every day in my clinic, right? So 8 cups of water is a standard one, right? But again, I want people to understand it changes between person to person. It changes with respect to your
weather as well.
With respect to your body mass index, like how big you are, how tall you are, all those stuff, and also with your physical activity. If you're a person who's like trekking, running, jogging, of course 8 cups is not enough for you. If you're, especially if your mother breastfeeding, of course you need more water, right? So this 8 cup is standard, but at least come
8 glasses.
Come se come 8 glasses pina hai, right? So if you drink at least 8 glasses of water, you can pee up to 5 to 8 times a day, but each pee should be a large one. When I say large, it is not like drops करके pee करना doesn't count. So it should be like a full bladder, and that should be around 5 to 8 times if you drink at least 8 cups of water.
5 to 6 times.
5 to 8 times.
5 to 8 times.
Yes.
Oh my God. Okay. I don't know how many times I go, but at least 4 times.
That's why I give everybody something called bladder diary. That's a very good self-check. Really? So even you can do at home, but do it for 3 consecutive days, day 1, day 2, day 3. Try to note down how many times you pee in a day. Just like for 6:30 you wake up, right? 6:30. Usually first pee will be large one because you're sleeping overnight and the bladder is full. So according to that, you can note it down medium and small. Small is something which you felt like urge hai, but ज़्यादा नहीं आया. Okay, that is small. इन दोनों के बीच में मीडियम है. So just write down how many times you pee in a day, and small, medium, large. And कितना पानी पीते हो?
कोई काम करता होगा तो सारा दिन पी अपनी काउंट करता रहेगा क्या?
बस 3 दिन के लिए सुषमा जी. But if you do that, you can find out your body condition कि how much you are drinking versus how much you are peeing, whether ये average में आता है कि नहीं. So just make sure you are drinking 8 cups of water, glasses of water, and see whether your pee is between 5 to 8 times, and mostly it is large. Trust me, I have seen women who pees 24 times in 24 hours.
No kidding.
I am not kidding. I have proof in my office that she has recorded 24 times. And
large?
Yes. Not large. It is like medium, so small, She cannot hold the pee. So she keeps peeing every now and then. And her quality of life was very bad.
So does one have to learn to control, to hold your pee? And is it good to control and hold your pee?
Yeah, this is where I want to not give a generalized statement here, because it depends upon each person. Everybody can't practice the same thing. So that's why I need to see individually what is your problem and find out how your bladder diary is. उसके बाद हम modification कर सकते हैं. Like there could be many people who have kidney issues or heart issues who cannot drink water more than standard. Like some people are said by doctors to avoid drinking too much water. So for those people, this doesn't hold good, right? So even some people who have diabetes, they pee frequently, right? So all those things matters. And of course, we can, this lady which I am talking about, from 24, within a week we were able to bring it to 17. Within 2 weeks, we were able to bring it to 10. And within 3 to 4 weeks, she was down to 8 from 24.
Wow.
And she cried when she came, and she said, it changed my quality of life because I am not in washroom in and out, going in, coming back, going in, coming back. That really affected. And she couldn't go anywhere, like, socialize or long drive because she is just worried, like, she cannot hold the pee. It changed her life for sure.
Now, I want to talk to you a little bit more because we've still got one break to go through. But is it the same issue with men that women also go through?
Yes. So on one hand, I was worried about women not coming to pelvic physio, right? On
Right.
the other hand, it is very hard to make a man come to pelvic physio.
Really?
Yeah. So my husband is a male pelvic physio. He
Okay.
treats male people.
Yeah.
And if I have seen 504 years, he has seen 3 in 2 years.
Really?
Yes. So that's
So men are as bad or worse than women?
men have bigger bladder, so they can hold better, hold longer. I mean,
Right.
ज़्यादा hold कर सकते हैं. But men also have incontinence. There's another problem, of course, like erectile dysfunction, जिनको sexual intercourse में problem होता है.
Right.
All these are pelvic floor related. And there is another thing, premature ejaculation. That is also related to. That is one of the reason for that is pelvic floor as well. There is also many psychological impact to it all as well. So this can also be resolved by getting male pelvic physio done. I don't see male clients. Of course, my husband can. So his name is Vinod. So you can contact me in the same number. I can get in touch with him. So men also have incontinence. Men also leak urine when they cough, sneeze. And men have a very, very big problem, Shushma ji. I don't know where to stop it. Hernias. The hernias are because they don't have knowledge of how to engage the core, how to engage the pelvic floor when they lift weight in gym. If you are a man, you are in the gym, or if you're a guy who goes to gym every day, please make sure that you know what you're doing. So men can get hernias and so many other pelvic floor issues due to lifting heavy weights. And they can get recurrent hernias even if they get the surgery done, the mesh surgery for it. It can still break and cause another hernia if you don't understand how to stop it.
Wow. Whenever you come, you scare the shit out of me. We're going to take a short commercial break and we'll be right back. गपशप का प्रोग्राम है. रामिया विनोद आज हमारे स्टूडियोज में हैं. We're talking about your sexual health, your physical health, your pelvic health. I sometimes wonder कि हमारे अपने कल्चर में माँ बाप अपनी बेटियों को शायद I think माएँ अपनी बेटियों को पीरियड के बारे में तो बताती हैं कि हर महीने ये स्यापा होने वाला है. That's what they say, right? पर उनको ये नहीं समझाती कि इसका मतलब क्या है, ये क्यों होता है. I don't think, I feel like I'm talking about 60 years ago, right? I mean, I am now 77 years old. I was 14 years old when I had my very first period, and my mother sat down with me. She cried a little bit, and then she said, "You're going to go through this every month. Does it hurt?" I said, "No, it didn't hurt at all." And she said, "Well, sometimes it will hurt." And so, but I think today's young mothers probably are more intelligent to be able to talk to their kids. But maybe they are not.
Yeah, that's what we all assume.
Huh.
I think it's all assumption, like every mother is talking about this, but to tell the truth, it's not happening. Not every mother. We think our world is going very fast, very advanced, and everybody knows everything. But I am seeing people, who are having very, very lack of basic knowledge. And to just tell about my example, like आपने आपकी first period के बारे में बोला था. जब मेरी first periods हुआ, I thought I'm dying out of cancer. I had an elder sister who was already attained the puberty.
Right.
उसने नहीं बताया.
Right.
My mom has 5-6 degrees.
Yes.
She has 6 degree of education, but she never thought. दूसरी बेटी को भी हो सकता है, उसको बोलना है, उसने बोला नहीं. तो 3 महीने तक मुझे होता रहा. I didn't know what to do, and I thought I was dying, and I was being very nice to my family because I thought I was going to leave them. Right? So jokes jokes apart, so we assume that educated people are better in this.
Right.
We assume this
Yeah.
community is better. No,
No.
we have this lack of knowledge in every community, in every place. Like for example, when me and my friends were talking, my friend was telling, when I said about periods to my daughter, she started crying and she said, I don't want periods. It sounds scary. But when I was talking to my daughter, the first question she asked was, where should I dispose the pad?
Yes.
Right? So kids are different, right?
Yes.
Kids are different. The mother's way of telling is different. I would just request mothers to not scare your kids. Don't give them a negative image about menstruation.
Yeah.
Don't tell them, oh, it's going to be like आपके जो mom ने बोला कि painful है. Of course it
Yeah.
is painful. You have to also understand and anticipate. अगर pain हो रहा है, you should not be worried.
Yeah.
But at the same time, nobody should scare the kid. कि
Yeah.
ऐसे हो जाएगा, उसके बाद गया, लेकिन हर महीना
दुनिया
होगा.
खत्म हो गई.
Yeah.
Chappa, this.
So there is a way to tell things, Similarly, I always feel like there is a very, very lack of knowledge about physical relationship.
Ramya, that's a topic that we probably might need to do a huge
Definitely.
program on that, because I was shocked to know that a 19-year-old young woman, just married, recently came here, and she and her husband haven't consummated their relationship.
Yeah.
In other words, they haven't had an intercourse.
Yeah.
And why? Because she is scared to death कि मुझे पता नहीं क्या हो जाएगा, and the guy just doesn't know how to coax her to get into that.
Yeah, so this I am seeing at least one case every month.
Really?
Yes, I am seeing, I treat them as a couple. I bring both husband and wife, because I have seen many people who are married for 3 years, 4 years, even down the line 5 years, that they are unable to have a physical relationship. And trust me, Shushma ji, I had a call from India. I couldn't believe. There was a call saying that me and my wife wants to have a baby, but my wife doesn't want to have intercourse. I'm like, okay. I'm like, are you planning to have baby with someone else then?
Yes.
Are you planning to adopt? She said, no, it should be our own baby. I mean, what the hell? Like, what are you talking? Then they say that we want to go to IVF.
Yeah.
We want to anesthetize her and put the baby inside.
Right.
But I don't want. My wife doesn't want to go through the sexual process. So I feel there is basic lack of understanding of this. People think it is very mechanical process to have baby, where it is not. It is more intimate, and it is more. It's like it's like building relationship. Physical contacts always build relationship. So I think many marriages are falling apart because of lack of physical relationship. Another thing, parents don't talk about this to kids, and kids also hesitate to open up to the parents. And of course, not everybody is comfortable going to a sex therapist, sexologist, because they feel like, oh, what if somebody knows that I'm going to them, and naam pe ek dabba ho jayega, right? So we have a very, I know, log kya kahenge. We have a very bad attitude towards counseling and psychiatrist. We always feel it's bad, right? So they don't get proper help. There is a problem called vaginismus. Vaginismus is the pain in that area where there is no physical reasons. Wahan kuch hai nahi, but still women feel like burning and pain, and she wouldn't let anything go in. Anything. Not even tampon, no pelvic exam with good doctors. They will not have a pap test. I know many women who is avoiding pap test just because she doesn't want to do it. So it's a very big problem.
Huge issue, huh?
Yeah.
Well, maybe next month we'll talk about that.
Definitely. I would love to.
But thank you for coming to the program today. It was a little X-rated program today, but I think we need to do that.
Yeah.
Don't we? Yes. Before the kids go back to school and they are in the car when mums are picking them
Definitely, yeah.
up. Ramya, if people wanted to talk to you, give your telephone number out one more time.
So it's 778
It's 778
320
320
0575.
0575 और ऑफिस में भी आप अपना नंबर लिखवा दीजिएगा, so that if people call us we can give them the number. With that we come to the end of our show. वो सभी बातें जो आज आपकी नज़रों में अटकी खटकी और दिल में समाई, उन सबको लेके we'll be here tomorrow. और कल कमल जी के साथ बात करेंगे मुगल आजम के बारे में. Stay tuned for the Drive Home Grind with DJ Flight and Maya right here on Spice Radio, और आपकी requests नुतिल लेंगी रेडियो रिमझिम पे.